Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, xerophthalmia, prophylaxis of xerophthalmia. Right. So, in the prophylaxis of xerophthalmia, it also depends upon the age of the child. If the child is in 6 to 12 months of age, we can give 1 lakh international units is given orally every 3 to 6 months. If the child has 1 to 6 years of age, then we can give 2 lakhs international units is given orally every 6 months. If the child is less than 6 months of age, 50,000 international units is given orally. If the child or if it is a lactating mother, 20,000 international units is given orally at delivery or during the next 2 months. We give 20,000 international units is given to the child, to the lactating mother.
thank you and thank you for watching.